Anna. Thank you for joining us today. To start off the conversation, I would like to know what drew you to Duke and how Duke is supporting you and what you want to do.
Sure. Thanks for having me, Erin. So I arrived at Duke in 2017 after I finished my clinical education in physical therapy. And I came to Duke to complete a master's at the Duke Global Health Institute. And now I work as a postdoc fellow within Duke Emergency Medicine. And I mostly work on international global health projects, but also I'm getting more and more involved in local projects within our patient population that present to Duke Emergency Medicine. Now, given that I am a postdoc, that means I'm still a junior researcher, still very much at the beginning of my academic research career. And Duke allows me to really have exposure to different roles, study designs, and also just a great team of mentors and colleagues who support me in building my independent research path and exploring how that could look like.
That's awesome. So what work were you doing with your master's that kind of brought you up to the work that you're doing now as your postdoc at Duke?
Yeah, so during my master's, I completed a mixed methods study in Bangladesh with young females who survived a very specific type of road traffic injury that resulted in cervical spinal cord injuries. And we conducted interviews with the patients, caregivers, and also their healthcare providers to really understand the experiences and challenges throughout the entire pathway. So that includes, thinking about prevention measures to, prevent that injury from happening in the first place, all the way through emergency care, access to and quality of care, the rehabilitation needs, and then also the transition into the community, how gender might play a role there, and just trying to understand how, life and the differences and the experiences you have living with a disability can look really, really different depending on what setting you live in and what your circumstances are. So I'm using this previous research experience and the exposure that I had there and the new understanding of how qualitative research can really help you understand and answer those questions in my work as a postdoc. And I'm attempting to add a different layer to the research studies to provide additional context and also gain more understanding and explanations of the research questions we're trying to answer.
That's really neat. So the work that you're doing now at Duke, where do you kind of see that moving in the future?
So personally, like I said, as a postdoc, I'm still at the beginning of my career. I'm thinking about different career development grants moving forward. And I'm also really interested in implementation science and intervention development with a specific focus really on a more holistic view on health and functioning and understanding how, social determinants of health and also just life is influencing your ability to maybe follow certain practices or lifestyles. So I think that qualitative research there is really hugely important to meet the really specific needs of certain population groups and kind of to inform the next steps. I think it's also a great way to actively involve participants in the development of interventions. And so I hope that qualitative research really just continues to gain more and more acceptance and will be utilized more consistently within clinical research whenever it's appropriate.
That's really neat. Well, thank you so much for sharing all this information with us and good luck with your postdoc and everything.
My pleasure. Thanks, Erin.